Hi, let me ask you first to just state your name.
I'm Dr. David Portman.
And you are?
I'm the director of the Columbus Center for Women's Health Research and private practice of gynecology in Columbus, Ohio.
Dr. Portman was involved in a number of studies at the North American Menopause Society, and I'm reporting with you today on one in particular, and this one is?
We looked at a very common symptom among women, which is hot flashes, vasomotor symptoms, and whether or not it impacted the way they responded to a SERM. Now a SERM, ospemifene or Osphena, is a medication that acts like an estrogen on some tissues and an anti-estrogen on others. So therefore some women will get hot flashes on this type of treatment.
That's why they call it SERM. It's a selective estrogen as opposed to just the hormone estrogen. It's not estrogen, but it works some ways like estrogen and some ways opposite to estrogen.
Right. So Osphena works as an estrogen on vaginal tissues but not on others, and one of the things that it acts as an anti-estrogen may be in causing hot flashes. We saw in the incidence of hot flashes roughly 7 to 10% of patients in these studies, with only 1% discontinuing due to hot flashes. But in this particular analysis, we wanted to see what particular traits patients had that might have made them more susceptible to hot flashes.
So some SERMs cause women to stop using them because the hot flashes are such a problem. They actually cause hot flashes.
Tamoxifen is a great example. Many women who really need to take tamoxifen because of its benefits on the breast may stop because of intolerable side effects.
Okay.
So we found that very few patients stopped this particular medication because of hot flashes, but they did occur. They tended to occur in patients who had hot flashes at baseline, who had more severe hot flashes at baseline, who may have been coming off of hormone therapy. So the take-home message would be that those would probably be the less than ideal patients to start a particular drug like this. If a patient is 5 to 10 years out into the menopause and bothered by painful sex, she is unlikely to be experiencing bothersome hot flashes by taking this drug. A woman who is experiencing hot flashes to begin with or coming off of estrogen may have a little bit more difficult time tolerating the hot flashes.
So you have a non-estrogen treatment for painful sex that will not cause hot flashes with the same frequency that most of this category of medicines do, but yet is highly effective for the painful sex.
It really looks like it helps the symptom that we want it to help, and that while hot flashes may emerge, they do seem to be tolerable, and very few patients discontinue because of it.
Thank you very much.
You're welcome.